Today's category for the Digital Health Awards is consumer wellness. That's one companies and solutions that are building products, services, and experiences designed to prioritize the overall well-being of consumers, empower them to take control of their health, and prevent health problems from occurring and or worsening. And clearly, digital health is really impacting that in many exciting ways, and many folks are getting into this space. And we have 12 amazing companies in the finalist group here. They're in two different broad categories in this category of consumer wellness. The first are best in class. These are often companies that have been around for a while, have raised a significant amount of capital. Some are 10 plus years or older and have been evolving into the digital health space. Some are younger, but are very well along their pathway. The next group are rising stars, younger, less funded companies, but also really exciting ones changing the game in digital health and consumer wellness. So we're going to start with our four best-in-class companies: Outset, Nuheara, Alto Pharmacy, and Ophelia. And I'm going to ask each of them to do a quick intro about what they do, a bit of one-on-one about their company, and then answer the question about sort of how we sort of see digital health often has been one size fits all. A lot of healthcare is one size fits all. We want precision digital health, and maybe any lessons you might have learned in your offerings to really meet the individual age, culture, language, user interface, design thinking that help amplify your consumer health solutions. So let's start off with Ophelia and with Outset and kick it off from there.
All right. Thank you, Daniel. My name is Michael Aragon. I'm the Chief Medical Officer at Outset Medical. We're a San Jose-based company looking to really solve the cost and complexity that has been inherent to dialysis delivery. When you look at dialysis in general, it's a very siloed healthcare system where you have devices that work only in the hospital or devices that work only in center. What Outset looked to do is surrounding innovation in water purification, surround that device with digital sensors, with a graphical user interface, really focused on patient-centered design to create a device that goes across the entire spectrum of wherever dialysis is delivered, all the way from the intensive care unit to the home, and try to simplify that entire process. Probably the biggest part of what we are doing in terms of changing healthcare is centered around the dialysis in the outpatient environment. Dialysis in general is a one-size-fits-all treatment. About 90% of the country dialyzes 3.5 hours to 4 hours 3 times a week, and everybody gets the same dose and the same treatment regardless of their size or other medical comorbidities. Home hemodialysis is the one modality that allows physicians and patients really to work together to decide what frequency and duration and intensity of dialysis best fits that patient. What we did with Tableau is create a device that is completely patient-centered. The graphical user interface guides users through every step of every treatment. So that way we really shorten the burden of training down from about 4 to 6 weeks to learn on more antiquated technologies to about 2 weeks. The device helps with troubleshooting, transmits records electronically, and allows real-time remote monitoring for physicians and nurses to actually look into those treatments as patients are dialyzing at home. So by reducing that complexity, we believe we firmly are expanding the home hemodialysis population, allowing more patients to be able to learn how to do these treatments, reducing the burden on those patients, and now allowing physicians and patients to work together to truly personalize that prescription to the individual.
Great. Thanks, Michael. And looking at pictures of your device, looks very beautiful design, almost Apple-esque. Any kind of design features that you'd share that were useful? And I guess, you have different cultures and ages and languages using this. What kind of things have you seen have really worked to make it engaging?
Well, I think a couple of big features. One is the water purification technology. We're the only device that actually incorporates that into the dialysis system. Every other device either needs a peripheral water purification system or sterile bags of dialysate. So you can imagine in a home, depending on the patient's size of their home or apartment, all the storage that could possibly be involved with that, or trying to manage multiple machines. So the water purification is key, but I think the other key you may not see in the pictures is it's only 36 inches tall. So we are purifying water, we are performing creating dialysate on demand, and we're providing a graphical user interface to guide all these treatments in just a 36 by 19 inch wide box. And so by keeping that footprint small, we can fit essentially into any home environment, whether you're in a small inner city apartment or whether you're in a large home.
Thanks, Michael. Speaking of shrinking technology, it's all coming to our ear. Let's hear from Nuheara.
Good morning. My name's Justin Miller. I'm the CEO and co-founder of Nuheara. We're an Australian-based but global hearing healthcare company that is essentially changing lives through the consumerization of hearing. Nuheara provides smart, affordable, lifestyle-based hearing solutions to the millions of people today that are not being serviced with traditional hearing solutions. I'm actually wearing mine today. And it's a type of product that can be used across multiple parts of an individual's lifestyle. It essentially, regulation, price, and convenience have hindered the adoption and growth of the early stage hearing loss market. Average age of a hearing aid wearer is 72. Average age of our wearer is 52. So we're proving if you get the right form factor, price point, feature sets, you'll attract a younger audience into this underserviced part of the hearing aid market.
And is this going beyond hearing loss? It looks like you have some consumer wellness applications for noise reduction, et cetera. Kind of what are your buckets of users?
Yeah, definitely. We take the best of audio and marry that with the best of hearing. We had to essentially take and clinically validate a hearing aid, but also clinically validate our self-fit technology as well. That essentially allows a user to buy this in more mainstream retail, take it home, and do the fitting in the comfort of their own home. So it's quite complex, but we're essentially taking the best of the hearing aid world, marrying that with an ANC headset, making it consumer and lifestyle driven, and making the product essentially adapt to one's lifestyle rather than just being pure hearing aid. And that's important when you're servicing a much younger part of the hearing market.
Right. I know when I talk to my parents on FaceTime, et cetera, it goes direct to their hearing aids, which is really amazing as an example. And obviously now new centrals can come into the hearing space as well and be really integrated into overall care.
Well, most of the hearing loss is perceived to mild to moderate, and that's essentially the part of the market where people don't buy products today. So we're not focused on the more severe and profound levels of hearing loss, which traditional audiologists and hearing aids do fit.
Great, fantastic. Well, let's switch over to quite a different company, Karen from Alto Pharmacy.
Yes. Alto Pharmacy is a full-service digital pharmacy, famous for our courier, same-day home delivery. We have redesigned the pharmacy operating system. We've built our own system from scratch. We also have a patient-facing app bringing pharmacy to your fingertips. And we have grown by partnering with providers. So we have a provider product called Alto Connect, where providers can actually see what happens to the prescriptions after they write them, track adherence, and direct message us in between appointments, as opposed to dealing with fax and phone. We are in 13 markets, and we have been in existence for 8 years. In terms of tailoring our product and service, pharmacy for decades has been one size fits all. We can kind of picture the scene when we close our eyes and imagine that. And we've customized this to our patients' needs and to our providers' needs. And I'll share a couple of examples. We started in the fertility space. So for anyone going through IVF, it's quite overwhelming. There's a lot of medications. They wanted time with our pharmacists, consultations on how to do an injection. We make our pharmacists available with a really warm, welcoming onboarding experience. And we've even added content in-app to provide guidance on injections. Another example, we expanded into chronic care. We've been very targeted by the disease states and providers that we work with. And when we went into endocrinology and cardiology, our typical process is to, as soon as your doctor sends us a prescription, we're going to send a text. We receive your prescription, click here to schedule your delivery this evening or whenever it's most convenient for you. And some of our older patients were like, who's this? And it's a text. So 17% of our chronic patients, we actually activate or onboard them to Alto via phone call. So we have a team dedicated to welcoming those patients, explaining how it works. And net, over 80% of our patients are using our app. So it really is illustrative of how best to onboard these patients. And then lastly, we have over-the-counter medications that patients can add to their cart in our app, like an e-commerce experience. And so we tailor what those recommendations would be based on their disease state and things that might be helpful.
Fantastic. I don't think anyone's going to miss facts-based medicine, but one of the big barriers often in outcomes is adherence. Any data on how you're able to improve engagement and adherence and refill rates?
Yeah. Absolutely. Adherence, we boost from a number of different ways. We eliminate a lot of the barriers that get in the way, whether it be first going to the pharmacy. We work with your doctor and insurance to find the best possible price. If a medication isn't covered, we're actually going to go do that prior authorization. We have auto refill. We have medication reminders. So traditionally, pharmacy, you do medication management to try to boost adherence for your most costly at-risk patients. We really try to do everything from the get-go, and our adherence numbers varies by disease state, medication, but are significantly higher than the industry norm, which is sadly only 50% of prescriptions are actually taken, and refill rates are even poorer. So on adherence, and then doctors, they increasingly, when we expanded to Texas, I'll share a brief story there. Suddenly doctors were like, oh, I'm held accountable to adherence and I have no way to actually move the needle on it. And they immediately gravitated to Alto because they could see, did they get their prescription? They could download an adherence report from Alto Connect, and they could really have an extension of their care team to provide that additional assistance to something that was ultimately impacting, their ability, what they were getting paid and their ability to employ their employees and continue to grow as they face more and more patients with chronic disease.
Great. Thanks, Karen. All right. From helping folks take their meds to maybe helping folks take less of the meds they should be taking, over to Zack Gray at Ophelia.
Thank you. Nice to meet everybody. Ophelia is a virtual provider of opioid addiction treatment, focused on expanding access to evidence-based care for the 80% of Americans who are struggling with opioid addiction but can't get any medical treatment. So there's a lot of talk about the opioid crisis as a problem, and it certainly is. Number one cause of death for Americans under 50. Another person dying every 6 minutes of an opioid overdose in this country, and that's increasing. But less appreciated is the fact that this is a highly treatable condition, and the treatment looks a lot like treatment for anxiety or depression, much less like rehab, as we're all told. So the medical protocol is long-term medication and counseling. And when you look at the evidence base, ultimately success comes down to getting people to opt in and stick with medication-based treatment. So we're providing care to patients who have no other touch point to the healthcare system. 4 out of 5 of our patients haven't seen a primary care doctor in years, about 70% Medicaid. And so we've managed to expand access and also improve retention by about 3x relative to national Medicaid averages and industry brick and mortar averages. What is tailored about our program is everything that can be. The challenge with most people trying to access addiction care is that there are high bars to entry and high requirements to retain. Much of that is driven by regulation and high overhead costs that come with having a brick and mortar facility, coupled with fee-for-service reimbursement incentives that require programs to do things that are not medically indicated, but frankly help them keep their doors open. What we do is give people exactly what they need and leave the rest up to them, which means tailor their medical protocols if they're using complicated substances, whether it be fentanyl or xylazine these days. Certainly have to keep up with the drug supply market by market. But beyond that, we're Zoom and text-based. We have a care team that helps patients with pharmacy issues, insurance issues, referrals to other treatment providers. And we've been fairly innovative in lowering the cost of care using technology so that we don't have to offer the unnecessary requirements that are typically there for revenue and not for health or patient satisfaction.
Right. Fantastic. Really important and impactful work and huge unmet need. Can you give any brief stats on how many folks you're able to get off of standard opioid painkillers, for example?
What do you mean, how many?
I mean, what percent, like folks who come in, how many are successfully able to sort of wean off? Or,
I mean, the vast majority are successful. So our 6-month retention rate is about 80%, and that's compared to an industry average of 30%. 12-month retention is 70%. So most of the drop-off happens in the first month. And often that's due to challenges successfully transitioning onto medication for opioid addiction. And often it's due to complicated inductions that are driven by inability to access medications from a pharmacy, or challenges starting the medication because of high tolerance driven by the ever-changing drug supply.
Great, thank you. Next up, we're switching to our rising star category. So we have 8 amazing companies there. They're younger, newer, and fresh on the scene. First, we're going to hear from Tim at Osara Health. Tim.
Thank you very much, and thank you everybody for having me. So a summary of myself. Firstly, I'm the Chief Operating Officer and co-founder of Osara Health, and our product is a behavior change product for people impacted by cancer. So that's both cancer patients and caregivers. And really what our goal is to help people better understand their cancer and their recovery and what actions that they can particularly take to improve clinical outcomes. So for example, we'll take exercise. Exercise can reduce the risk of cancer coming back and reduce the severity of chemotherapy, but it's not something that's typically covered by clinical care teams. Just they generally don't have the time. Symptom tracking is another one, can improve overall survival and reduce readmission rates, but that's not typically something that's covered extensively by clinical care teams, and only 2% of the general population do that. So really what we're trying to do through our intervention is trying to change patient and caregiver behavior to engage in outcomes that are clinically meaningful. And we deliver that in intervention via a mixture of human health coaching and human empathy. So that we do that over the phone and via SMS, and then also through digital touch points. And then through the program, what we're able to do is change the behavior so that patients feel really empowered and they understand exactly what they can do to improve their own clinical outcomes. They are closer to their clinical care teams. They ask better questions. They talk to their employer more around how they can use work as a form of rehabilitation, and really just more empowered and engaged in their recovery. They're back in the driver's seat. And through that, we've been able to demonstrate through peer-reviewed evidence improvements in things like quality of life, physical health, mental health, and then improved return to work rates as well. So that's a summary of our intervention.
Fantastic. It looks like you're not just having coaches for the patients, but also for caregivers. And I'm an oncologist by background. I definitely see the need here. How do you interact with the clinical teams to keep it integrated?
No, that's a really good point. And we initially started with the patients, and then as we worked with employers, we realized that caregivers were a significantly unmet need, and 46% of caregivers of someone with a cancer diagnosis have anxiety or depression. So we developed a similar intervention specifically for the caregiver to help them essentially become an expert caregiver, but also practice self-care principles, because often they're the caregiver left behind. But to your question around the interaction with the clinical care team, the way we approach it is not to disintermediate a person and their clinical care team. There's some most people have terrific care teams that play a significantly role in providing clinical advice. Our goal is not to get in between that. It's to bring you closer to that care team. So how can you ask better questions? How can you build on what you are being told and your treatment through your care team? How can we bring you closer, and how can we complement and augment the treatment path that you were already on, rather than kind of get in the way?
Great. Thanks, Tim. Amazing work. Switching gears a little bit to the microbiome, it sounds like, over to Ayble and Sam.
Yeah, thank you for the opportunity, and congratulations to the rest of the folks here. Really, really cool to learn about everything everybody's doing. My name is Sam Jactel, founder and CEO at Ayble Health. We're a digestive health company, and we deliver personalized nutrition and psychological therapy to GI patients, with kind of a goal to improve the likelihood that people ever get better and to keep them better as long as possible afterwards. So Ayble was built out of necessity. So I'm a GI patient myself. I've been an IBD patient for about 10 years with a family history of this for a long time. And so, from our perspective, a lot of what we see in the space is that one size fits all does not fit all. So, our approach has been to take a one size fits none approach to deliver this care. We do it in kind of two ways. One is a machine and the other one is a human. So on the machine side, Ayble is built on the largest GI database in the world. And we utilize AI and machine learning to personalize a pathway through nutrition and a pathway through psychology that has the highest likelihood of getting someone better according to the data that we have and that we continuously gather from people as they utilize the platform in an anonymized and aggregated way. We always keep the door open for patients to disagree with the protocol and the next best action, which I think is really great and allows us to kind of learn in an open loop manner. But we also have coaches on the other end. And so that is really important to treat the person, because at the end of the day, that's who we are as patients. We're not a clinical, set of symptoms. We are people as well. So that's kind of how we think about that. And then I think the last element is thinking about the person as an N of one, utilizing and understanding the cultural background, and where that person is, and meeting them where they are, not where the health system expects patients to be. And so one of the things that we've developed is also a suite of tools, and I'll highlight one of them, which is a groceries database. So it's one thing to tell someone that they have to avoid certain foods that are triggering symptoms. It's very much another thing to help them actually go to the grocery store, purchase the products that are safe for them to eat, and then understand the kinds of recipes that they need to tweak and edit according to their background, their family needs, and complexities outside of just GI. So what if you're, kosher, halal, if you have to eat low sodium for another reason, and you have to avoid onions and garlic, you're not super fun to go to dinner with, but you need to be able to live like that in real life. So that's kind of how we think about those elements.
Awesome. Quick question. I imagine you're also becoming a bit of a big data company. There's so much data involved in the gut and IBD and all these variabilities. Are you kind of ability to crowdsource and learn and hone your precision interventions?
Yeah, exactly. That's I kind of say we're a data science company with a pooping problem. In the sense that, one of the things that we've been kind of purposely built to do is gather the anonymized and aggregated data from each of the patients that complete our program, both on the nutrition side and the psychology side, to learn from each patient. So each patient's kind of planting in this garden that the next patient then gets to absorb and benefit from with faster, more effective, and easier program to complete.
Great. Thanks so much. All right, over to Tawny at Paloma Health.
Yes. Hello, everybody. Happy to be here. My name is Tawny Hammett. I'm the Chief Revenue Officer at Paloma Health. Paloma Health is the only virtual clinic that's specializing in Hashimoto's and hypothyroidism. So hypothyroidism is when your thyroid, which is the butterfly-shaped gland in your neck, doesn't produce enough hormones. And given its importance of your body, how it regulates your temperature, your weight, your metabolism, your cardiac function, when it's not producing enough the hormone, a lot of things can go awry in the body. We've taken a very different approach to the standard treatment of hypothyroidism and taken a more holistic and integrated approach to care. So talking about one size fits all, hypothyroidism, the treatment has been generally the same for the past 75 years. And it's one of the most top drugs prescribed in the world, levothyroxine. A lot of patients come to us and they say their doctor has just given them this prescription and things haven't worked out. Their biomarkers look fine. And they come to us because we take a very different approach. Our physicians, we have a team of physicians, endocrinologists, integrated family care medicine, registered dietitians, health coaches that are looking at this. They see trends and patterns from the thousands of hypothyroid patients that we've seen. And they can assess what are some of the different interventions that they can take on a personalized per patient level. And we've built the technology on top of it. We have chronic condition management where we have symptom trackers, we have medication management, we have thyroid guides, we have a supportive patient community where patients can actually interact with each other, talk about where they've had success and thyroid recipes and exercises and mental health, because it is a chronic condition that can impact them for the rest of their lives. And a big component of it is our health coaches, which is a big supportive tool that we have in addition with our clinicians at hand.
Fantastic. What have you learned about not just engaging patients and consumers, but the clinicians, the endocrinologists, so that your solution integrates into their workflow and ability to interact with their patients?
Yes, absolutely. So we've built, we are a physician practice. We use Athena, but we've also built technology on top of it for our physicians so they can interact with each other. And then also we've built a web-based portal for our patients.
Perfect. Looking forward to learning more. Let's switch over to Lumos and Biquan.
Hi, everyone. My name is Biquan Luo, founder and CEO of Lumos. Lumos, we're building a sleep and fatigue management to help people sleep better and have the best performance when and where they need it. So this could go from the military or the high performance athletes, world champions, to everyday people like you and me. So if you think of sleep, if you think of your friends and family, you could probably name a few people who have trouble sleeping. They could be traveling a lot for work, or they could work night shift, or they just have difficulty falling asleep or have difficulty waking up and feeling groggy. So a lot of times, these sleep problems have something to do with your circadian rhythm, which is your body's natural rhythm to dictate when you sleep and when you wake up. And that's what we come in. We want to use science to help you reprogram your circadian rhythm to fit in different scenarios where you need different sleep schedules. So that speaks to the individualization piece, because sleep is such a multifaceted problem, and everybody has different needs and different conditions of sleep. So what we want to do, and what we're currently doing on two levels, one is the front end, the other one is the back end. So on the front end, we talk to people, understand their experience, understand their ecosystem of different populations. So there's travelers, there's night shift workers, and there's like people, night owls, have trouble waking up. So every group has a different workflow that we created for them that fits their needs. And we try to integrate their ecosystem, so the common tools that they use to schedule their sleep, and we try to work with the tools in their ecosystem. And then on the back end, we create specific algorithm for these individual groups. So the algorithm for travel will be different from the algorithm for night shift. So we create different algorithm to try to achieve the best effect for each individual groups.
And given that many consumers and sleepers, if we all sleep or try to, have their own devices now, is it bring your own device? Do you integrate with Fitbit and Apple Watch and Oura Ring for the data, and how to use that data to improve your algorithms?
Yeah, not right now, but that's the goal in the future, immediate future, that we want to integrate with different trackers so we can collect information on their sleep and on their performance, on their other parameters that these other trackers collect, and then feed into our model. So we're developing a model to take into the input of those parameters, and then we improved our light program for each individual based on these individual parameters.
Great, awesome. Switching slightly differently now to next company, Finalist, known as the Owl app, but also knowRX Health. You guys are up next.
Yeah, good day, Dr. Kraft and all the other finalists. It's great to be here. I'm David Franklin, founder and CEO of knowRX Health. Our finalist application is around the Owl app. knowRX Health is using machine learning technology to identify the probability of side effects in medication usage through patient-reported objective measures, along with connected devices and wearable devices. So the mobile application drives medication adherence, as well as health literacy and better communications with their care team. What we do specifically is look at the side effects associated with all medications and deliver health literacy content specific to them. So making the user experience unique to the individual, specific to their ICD-10 or their medication therapy that they're on. This data itself, again, as we analyze it, will be used to identify the probability of side effects, which generates new care plans, but also helps researchers identify gaps for precision medications based off age, race, and genders in underserved communities. So this is where we're at today with the application and the company itself.
Thanks. I imagine you're also dealing with like a lot of polypharmacy and sort of the blending of multiple drugs in individual patients.
Yes, right now we're agnostic, so we don't focus on one drug. We focus on just therapeutics in general. We have a wide range. If I look at my dashboard, I can see age, race, and gender, who's on a medication, where they're at, how they're being prescribed, what dosage, and if there's any side effects being reported. And then also if they have wearable devices or connected devices associated to those to trend the patterns. And that's what we're looking at to generate the content. Here, understand, I lost my father in 2018 due to a medication side effect while in the ICU, and this is what prompted my passion to solve this, but also an understanding that nearly 80% of clinical trial data has insufficient data to prove safety and effectiveness in non-white participants. We have to drive a better data set into the researchers from a post-market surveillance point of view, capturing the real-world data for these researchers to have a better understanding of what's actually taking place.
Awesome. Really important work. Let's hear now from Sonde Health, David Liu.
Hi, everybody. Thanks. My name is David. I'm the CEO of Sonde Health. It's actually Sonde, though it looks like Sonde. So, but great to be here. We are squarely in the prevention space. We're trying to attack this big problem of keeping people well, because the amount of money and resources that every country in the world is spending on treating chronic disease is getting out of control, and it'll make up half of the world's GDP by 2030. So we can't be bankrupting countries treating everything. So we're going to try to keep people healthy, and we're harnessing voice and vocal biomarkers as a new vital sign for proactive health tracking. And we're a platform that takes these vocal biomarkers through voice-enabled devices and apps, and we're able to give you very detailed insights into mental health, respiratory health, and coming soon, cognitive health and cognitive impairment. And so our whole platform is built on the world's largest, deepest, most diverse voice data set. We are analyzing the sound of your voice, not what you say. We do not do any NLP work. And because voice is such a rich data set, has such a rich data set, and can tell us so much about what is happening within your body, whether it be from the shoulders up or within your respiratory system, we can begin to provide people with the information and the insight that is necessary to create awareness, activation for behavior change and lifestyle change, which is really going to be the key. And so we enable and turn any device with a microphone into a health tracking device. We do not require anyone to purchase an expensive $350 wearable or ring or watch. And we're working with very large device OEMs, as well as automakers, and even, of course, digital health apps that are already out there and being used by a lot of people to do this work. So we're really excited about providing this information and insight to, again, spur that behavior change.
Fantastic. So with Sonde Health, are you more of a platform where you can plug into other providers, mental health providers, clinicians? And maybe that's question one. And briefly, two, how does this UI work? I'm about to download the app, but if it picks up my voice that has some neurologic issue, et cetera, what happens next?
Yeah, so we are API SDK first. And so our platform is enabling these other consumer-facing platforms or devices to be able to pick up voice and analyze it. The app that you're talking about, Sonde Mental Fitness, is kind of our showcase app to be able to show people what vocal biomarkers looks like when you actually experience it yourself. But really great question about, what happens when we tell you to pay attention. We're not a digital diagnostic. We do not tell you that you need to go see a clinician. Again, we're firmly in this upfront kind of space before there's a problem. We want to be able to, just like the Apple Watch and some of the great wearables that have been established over the years, give you that kind of longitudinal view into what's happening with your mental fitness or your mental health. And then, of course, if there are trends that you can pick up on through this data, then you can act upon it, maybe by taking an assessment, but maybe it's just getting more sleep. Maybe we can work with Lumos or other folks, but we know that behavior change is the key, and we know that it's very difficult to change behavior. But if you can provide people with excellent objective data and insight, we do believe over time, just as the Apple Watch has shown us, we start to pay attention to those things that we track.
Great. Thanks, David. From Sonde to Soundwave, over to Soundwave.
Yeah, some synergies there, David. Very interesting. Thank you. Anthony Florek, I'm co-founder, president, and CEO of Soundwave Hearing. Soundwave is an innovative health technology company that sells the award-winning Sontro OTC hearing aid powered by the smart Auto-Tune app. So at Soundwave, we're passionately committed to the idea that good hearing helps improve lives. So you heard from Justin earlier with Nuheara, so we're certainly a rising star, but we're simple because in our form factor is a little bit different. It fits conspicuously behind the ear versus in the ear. And you can't really see that. So, simple because our potential consumer can order online from Amazon, Walmart.com, etc., and receive it and set it up in the privacy and comfort of their home. It's 75% less than some of the prescription hearing aids that are $4,000, $5,000, $6,000 here in the U.S. And it's convenient because it's a 3-minute hearing test. So our secret sauce is the way we test hearing. So we're testing all frequencies, all intensities in both ears in situ through the hearing aids with an app and at the comfort of someone's kitchen table. So it was designed, engineered, and it's assembled here in the U.S. We actually, if someone sits outside the mild to moderate hearing loss, we'll tell that patient and say, go see a hearing care professional. Our app also comes with an oral rehab program. We partner with a company called Amplify. So we get a hearing health coach and a peer support community the consumers do. So it's just not a hearing amplification product and an app. It's a whole system that says, hey, you haven't heard sounds in a while. Here's a better and more interesting way to do it because your brain hasn't heard them in some time. So we're riding the tailwinds of the regulations, the power of AI and machine learning, the power of the cell phone, the demographics of seniors, as Justin mentioned, and there's David mentioned cognitive decline, and we're writing that as well. The number one modifiable risk factor to cognitive decline is hearing loss. So we put our app on a tablet to allow independent pharmacies to test hearing with their consumers and as a point of care test and offer an OTC solution like the Sontro.
Fantastic. And real quick, what insights are you gleaning from the testing? Are many folks not realizing they have hearing loss and finding that they are and then using your product?
Yeah, absolutely. Yeah. So we could, if they buy our product, they certainly test with our app through the Auto-Tune app, which is awesome. But a lot of people, the pharmacists ask us all the time, how does someone know if they have hearing loss? So we gave them a solution that they could charge for. It's a point of care test, another clinical service like testing for cognitive decline or a functional medicine test that they would typically do, and then offer them the pharmacy or the consumer a solution like the Sontro OTC hearing aid.
Fantastic work. Now for something completely different, over to CIONIC and Jeremiah.
Thank you so much for having me. My name is Jeremiah Robison, and I am the founder of CIONIC, where we build bionic clothing to help people walk. I started the company in 2018, a really personal mission to me to help my daughter, who has a diagnosis of cerebral palsy, to grow her independence and to help her walk. She's not alone. She's one of 200 million people worldwide who suffer from impaired mobility, and this is a group that is growing very fast. Diseases like multiple sclerosis, stroke, spinal cord injuries, chronic pain, and more are impacting people's mobility every day. And the standard of care hasn't changed in 100 years. It is classic DME, crutches, walkers, wheelchairs, rigid bracing. And we believe that we could do something better, that we could build a platform that could first and foremost measure what is happening within the neurophysiology of each individual, and then build real-time adaptive interventions. I'm excited to share that our first product is called the CIONIC Neural Sleeve, and it is a lycra-based garment with sensors embedded into the fabric that measures one, how the muscles are firing, and two, the orientation of limbs in space, and then designs a customized intervention using functional electrical stimulation to activate each muscle during the gait cycle in sequence, and helping people have a more natural, normative, and safe gait pattern. We've been shipping since January of this year, and we've seen some amazing outcomes with our users. And I just highlight a few. One of our users, a young veteran with MS, she was using a wheelchair as her primary mobility, and now she's shared with us that she is able to keep up with her boys and run all the errands and do just the care that she wants to do for her loved ones. Another one shared that she went on vacation to Alaska and she hadn't been able to go out and do these things. These are these very things that we take for granted on a regular basis. And my favorite one was a young man who walked his daughter down the aisle and was able to dance with her for her first dance. And this is what we think is our real special sauce, is that we are pioneering a new model for what I think is critical in precision-based healthcare, which is home medical device-based therapeutics. That starts with full regulatory compliance. We're an FDA Class 2 prescription-only medical device, but we can deliver that to their home. We are telehealth native, meaning that we can set up an appointment, we ship it to your house. Our mobility specialists get onto a call with each user, customizes the solution for them, and then can continue to follow up and make sure that they get the most out of this technology. We even pioneered on the payment side. So standard medical device, one big payment up front. We say, no, pay as you go, like it would be a pharmaceutical. And then AI-based precision treatment that continues to adapt as their condition changes.
Terrific. I've been tracking you guys for a while, so congrats on your launch. One quick question: is this going to evolve past folks with particular neurologic diseases for folks who are 95 years old and want to walk up a mountain, and enable, mobility for stroke victims, etc.?
Absolutely. Stroke is one of our core audiences today, but I do see the future of bionic clothing encompassing the entirety of the mobility spectrum, especially as the body ages and breaks down. And the key to that is making something that is lightweight, comfortable, customized, but filled with the intelligence to continuously monitor and be able to intervene in real time across the activities of daily living.
All right, great. Thanks. We've heard from all of our amazing rising stars and best in class, really incredible and diverse companies here. We're going to have just about 10, 12 minutes left for some real quick questions and answers. So I'm going to just ask for 20-second answers, and feel free to throw in other elements. But one, this is sort of a consumer category, though some of these certainly blend into the medical. So anyone wants to jump in first with how they see that transition and how you're making that happen? And the sort of second question no one else to jump on that is, how are you guys generating evidence to show the value in our now increasingly value-based care system? So please raise your hand. Someone jump in first, and then we'll call out from there.
I'll jump in real quick. We're not jumping into the medical space. I think that's the key. Once somebody is diagnosed, we believe it's a little bit late. And so we want to be able to keep people on that healthy path. And so getting into devices and apps that people are already using every single day, we're seeing people's interactions and engagement with voice to be incredibly high, 3+ times a week. People using our capabilities within these devices and apps, and seeing engagement rates. Retention rates of over 85% over 4 weeks plus. And I think that, to me, is very encouraging. People want to be able to understand what's going on, but they don't want to spend a lot of money or time to do it. And so that's how we're looking at it. In terms of what was the follow-up?
Well, and then how measuring outcomes, which is always the trick,
Yes. So we're aligned, and we just had a big study that we're going to go ahead and submit for peer review and publication soon. That came back, and we're actually aligned and with medically validated assessments for mental health, as well as respiratory health, asthma, and COPD. So that is a very key component for us, even though we're in this prevention space.
Great. Over to Sam, and then to Zack. Sam.
Yeah, I appreciate it. So two elements to this question. I think the first one is around how we're integrating with the healthcare ecosystem. One of the things that's really important, for us is to understand that there are kind of two problems in gastroenterology. There's a tools problem, which is that the drugs and the scalpels aren't always solving the problem. And so utilizing other tools like diet and psychology are extremely valuable to build an ecosystem of support for patients to get them better and keep them better. The second problem is an access problem. There are way too many of me as a patient, and there are way too few physicians like yourself, right? And so we serve to enhance care wherever it's delivered. So we're being utilized in 7 of the top 10 academic medical centers in the country as part of standard of care for GI patients, and that's really exciting for us. We want to be used as part of that solution. Obviously, to do that, you need to have a standard of evidence. That's really important. Moving fast and breaking things doesn't apply, in my opinion, in healthcare. And so we actually have 14 peer-reviewed publications, including 4 randomized and controlled studies on over 4,000 patients. And we, that's our goal, right? Is to lead with that evidence and to show kind of our evidence in three places. One is that we're able to improve outcomes for a vast majority of the people that utilize Ayble. The second is that when they utilize Ayble and their symptoms go down initially, do their symptoms stay down? Because that's how you actually transform outcomes and ROI. And the last piece is, does it address all the other comorbidities? So in GI, that also overlaps with mental health as well as women's health. And then, of course, workplace productivity. So being able to hit those 3 things is why we have done a lot of that work in the clinic before commercializing.
Got it. Thanks. Over to Zack and Ophelia. 30-second answers. Zack.
Yeah, I mean, I think the core problems in solving opioid addiction are consumer engagement problems. The health ecosystem is not good at finding, educating, engaging, and keeping people in care, which is in large part the gap that we fill. In order to get our health plans involved, we've taken a sort of judo approach where we started cash pay, showed that there were Medicaid enrollees willing to pay us $195 a month instead of going in network. That got the plans interested. They let us in network with fee-for-service contracts. We then built up our data, demonstrate with the ability to demonstrate outcomes in their own database, which then allowed us to pivot to bundles and get their support to actually help with the engagement through predictive analytics and co-marketing.
Great, thank you. Tim, you're up next.
Brilliant. And I think I shared earlier around our product is medical adjacent. We're trying to bring people closer to their clinical care teams. And one of the ways we can do that is with symptom tracking. 2% of the general population track their symptoms, 65% of our patients track their symptoms. And what you end up doing is getting more data-driven decisions and therefore better treatment and then they're better outcomes. And from an evidence perspective, I think as everyone agrees here, evidence is the currency of digital health. And so we're similarly trying to lead with that. So we've got 10 peer-reviewed studies, one demonstrating that we improved return to work rates by 70% for people impacted by cancer and 4 months sooner. And then another piece of evidence demonstrating improvements in quality of life, pain, physical health, mental health, and fatigue. So again, trying to lead with that evidence. Hopefully that's quick enough. Over to the next.
Michael from Outset.
Yeah, absolutely. Thanks. So while obviously dialysis and stage kidney disease is a medical issue and requires a physician prescription, what we're doing is transitioning health to where the patient is in control. And therefore, we've designed this as a consumer-based product using human factors to ensure retention, usability, ease of use. We track that data. Probably the most important metric we follow is retention. If you burden a patient with doing their own dialysis treatment, you historically have seen them burn out. We follow that very, very closely. And then we're following outcomes related to sleep, insomnia, a big problem for dialysis patients, but also recurrent hospitalizations, depression, physical and mental health. So we follow all of those. We have a very large registry going on right now. Continue to follow that out to a year to look at our impact on that, as well as medical metrics and clearance and dialysis quality.
Great. Awesome. Yeah, lots of data in dialysis. Tawny, over to you.
All right. So we have our own published internal research, but one of the ways that we're looking at clinical outcomes, we're actually tying into our business agreements. So we're partnering with some of these enterprise groups, and we're putting agreements that we have costs tied to reduction in total cost of care, and we're also looking at clinical outcomes. So one of the big things that we're getting from our partners are negative control groups, so that we can see patients that also have hypothyroidism and then also comparing them to the ones that go through our program. So I think this is going to be a major step forward in getting a clinical evidence.
Right, you're comparing maybe folks off your program and on your program, sort of generic hyperthyroid patients.
Correct. So third validation.
Karen, how do you guys look at things from Alto?
Yeah, I think pharmacy is traditionally very downstream in healthcare. So I'm very excited by some of the earlier engagement mechanisms. We do a lot in endocrinology. And I would say the rise of CGMs, knowing that 1 out of 3 Americans are pre-diabetic and giving them and their doctors that insight sooner. In addition, we are integrating a lot of digital therapeutics in our app. We have a very captive audience that is there to monitor and manage their medications, and getting that digital therapeutic aspect, I think, is really valuable. And then lastly, some of the diagnostics and the fertility side, typically women, take on that responsibility and burden, and now introducing some male fertility diagnostics to provide a more holistic view of how best to navigate their care pathway.
Yeah, some interesting solutions in that space for sure. Thanks. Biquan.
Yeah, so like David said, we're mostly in the preventative medicine space, helping people to establish a healthy lifestyle. But for certain populations, we do want to get into the medical, like healthcare industry. For example, we're doing clinical studies on neurological disease patients to prove that we can improve their outcome of disease and progress. So that's one approach. And then the second one is, with a lot of healthcare professionals, they have burnouts and they do night shift and they don't sleep well, and there tend to be accidents and mistakes. So what we can do is to help them stay alert when they're doing night shift, to reduce human errors and improve healthcare outcomes. The way we do that is by having grant-supported clinical studies, double-blind controlled studies, to show that we can improve alertness and improve the sleep and other outcome of healthcare provider and other groups.
Thanks. Sleep is key. Over to Jeremiah and then Justin to bring us home. Jeremiah.
Awesome. Yeah, I mean, it's clear that health is the largest consumer spend, regardless of whether the payers pay for it or not. And so the question is, how do we take this growing spend and accelerate innovation with that? And I use the example of the average medical device class 2 takes 6 years and $30 million to bring to market. That really limits innovation. So what we're trying to do is open up our platform, open up the data, open up the software, and ultimately the wearable neuromodulation platform, so that people can build new solutions, new therapeutics at software speeds and software costs to address this growing tail of the population.
Fantastic. Thanks. And last but not least, Justin from Nuheara.
Thank you. Yeah, look, very, very simplistically, we're here to complement the current audiological processes. We're here to provide a market to an underserviced or an unmet need in global hearing, healthier aging, failure to treat hearing loss at an earlier age increases the risk of dementia by 3 to 5 times. So from our perspective, we're targeting that younger customer that will, I guess, self-start their own hearing healthcare journey and reduce a number of conditions as they age. And we're proving that through evidence-based and attracting a clientele that's 20 years in advance of an average hearing aid customer. Thank you.
You mentioned briefly there that dementia is associated with folks not hearing well, not the other way around. So if you might improve hearing earlier, you might prevent some dementia.
If you treat hearing loss at a much earlier age, yes, you will reduce the risk of dementia.
Awesome. Now hear this. All right. Well, thank you very much to all our best in class and rising stars. You guys are all you've already won. Hope to see you at Vegas at the finals at HLTH, and keep on what you're doing. It's really important work and hard, but healthcare is hard, but worth it.
Hi, my name is David Cannington, co-founder and executive director of Nuheara, coming to you from my home in Perth, Australia. Over 40 million people in the US have some degree of hearing loss, while less than 15% of them are doing something about it. Cost and inconvenience are the main reason. Thanks to the FDA, there is now a new category of OTC hearing aids you can purchase in retail and online that are more affordable and accessible to the average consumer. HP Hearing Pro, powered by Nuheara, is the first FDA-cleared self-fit OTC hearing aid designed for people with perceived mild to moderate hearing loss. Unlike most other hearing aids, HP Hearing Pro is an earbud style that is more socially acceptable and diminishes the stigma associated with wearing a hearing aid. What is unique and powerful about HP Hearing Pro is our proprietary Ear ID self-fit technology, which is accessed through the HP Hearing Pro mobile app for both iOS and Android. Ear ID has been medically validated to be substantially equivalent to a professionally fit prescriptive hearing aid, so the consumer doesn't need to visit a hearing clinic to have their hearing aid fitted. In essence, it's the world's first DIY hearing aid. Furthermore, we've integrated best-in-class earbud technology, including high-fidelity sound and noise cancellation, combined with FDA-cleared hearing enhancement technology to deliver what is truly a complete fit-for-your-lifestyle hearing aid solution for less than $700. With the globally respected HP brand and our company's history of developing disruptive hearing aid technology, our mission is to make hearing health affordable and accessible to the hundreds of millions of people around the globe who experience some degree of hearing loss. Our vision is that one day consumers will be able to access cutting-edge hearing aid technology to manage their hearing health from home at a price that is affordable and not out of reach to the majority of the population. We believe that with HP Hearing Pro, we are well on the way of making that a reality.
Delivering dialysis has remained a burdensome, complex, and costly process with very little change over the last few decades. Our view was, why not apply modern technology to dialysis? And the answer is, there's no reason you can't. And so we did. We developed Tableau, a first-of-its-kind technology that reduces the cost and complexity of dialysis anywhere it's delivered, from the hospital all the way to the home. For the first time, a single system can deliver dialysis anywhere, anytime, by virtually anyone. That's Tableau, an enterprise solution for dialysis. We've all heard the saying, fortune favors the bold, and this is a bold team and an imaginative, impatient one. How fast can we respond to a user suggestion? When can we get the next software release out? What can we do to make the experience just that much easier? We attack obstacles and execute on opportunities with creativity and speed because we're a diverse group of thinkers, doers, and believers. Our mantra at Outset is better begins now. Each part of that declaration says something about our mission. Better. We are determined to radically elevate the experience for patients and reduce the cost of care for providers. Begins now. After decades of receiving good enough, patients and providers deserve great. Not tomorrow, not next month, not next year. They deserve great now. With structural market tailwinds at our back, a first-of-its-kind technology, and an aspirational, execution-focused team, we believe we are uniquely positioned to deliver on this very promise. Better begins now.
Hi, I'm Zack, founder and CEO of Ophelia, a virtual provider of opioid addiction treatment. I started Ophelia back in 2019 after losing my girlfriend to an opioid overdose, who found it easier to get treatment medication on the black market than from a clinician. A lot of people talk about the opioid epidemic as if it's a hopeless tragedy. But in reality, opioid addiction is highly treatable. And the treatments look very little like rehab, as we're all told, and almost identical to the treatment for depression or anxiety that millions of us are getting today. Yet 80% of Americans who need care can't get it, and a small fraction of the ones who do get proper care. So the problem is access. Ophelia's solution is simple. We offer the latest in evidence-based treatment virtually, informed by data analytics and technology that can keep up with the nuances of the latest drug supply market by market. Our superpower is that we have a keen understanding of patient psychology. These people want to get help, but they don't want to go to rehab or be treated like drug addicts, which is why many are willing to spend thousands of dollars for the same medication on the street instead of using their insurance to get it from a legitimate medical provider. So we take our design inspiration from the drug dealers who have cracked patient experience and are winning this war, and we're fearless in our commitment to serving everyone, whether they have insurance or not, Medicaid or not, and today about 75% of our patients are on Medicaid. Ophelia should win this award because opioid addiction is the #1 cause of death for Americans under 50. Ophelia is the solution. We are expanding access, improving outcomes, vastly improving patient experience, and doing so all at lower cost, which is saving the healthcare system lots of money. And the only thing that's holding us back is support and awareness from the ecosystem, which I believe this award can help us.
My name is Mike McClay, and I'm the Chief Technology Officer at Alto Pharmacy. Alto is a full-service digital pharmacy that combines expert care with purpose-built technology to maximize the possibilities of pharmacy and provide the best patient experience. We streamline every step of the prescription process for patients and providers, from order to delivery through an integrated technology stack that includes an internal pharmacy management system, a provider communications portal, and a top-rated mobile app. Our superpower is our commitment to our patients. One of Alto's founding values is patients come first, and this comes to life every day through the services we provide and the decisions we make. We have many valued customers, and we always start with the patient and work backwards from their needs. This keeps us true to our core obsession to create a healthcare company that cares about helping people above all else. Alto should win in the consumer wellness category because we truly do prioritize the overall well-being of consumers, empower them to take control of their health and prevent health problems from occurring or worsening. We provide resources like in-app medication management tools and access for all patients to expert pharmacists 7 days a week to make it easier to start and stick with treatment. That's why our patients have a 70% primary adherence rate compared to an industry average of 50%. Our patients can schedule deliveries at a time and place that works best for them, by courier delivery or mail. And we use automation that searches for copay cards, coupons, and other options to find the most competitive pricing. In fact, Alto has fulfilled more than 6 million prescriptions and has provided patients with more than $190 million in savings to date. We are grateful to all of our patients and look forward to serving even more in the years to come.
Hi, I'm David Luo, CEO of Sonde Health, the leading vocal biomarker for health company. At Sonde, we believe that personalized health insights derived from voice can be the catalyst for positive behavior change, leading to longer, healthier lives. We have developed a technology platform that harnesses the power of voice as a vital sign for proactive health tracking. Why is preventive health so important and needed? Well, globally, healthcare has been based on a sick care system that waits for one to become sick before it kicks into action. We can do better. In fact, 80% of all chronic diseases can be prevented through healthy behaviors and lifestyle. And yet, 6 in 10 Americans live with one chronic disease, and half the world's population will develop a mental health disorder by the age of 75. This is why prevention capabilities can and will have a massive impact on global healthcare. Catching health issues sooner can result in behavior changes, more targeted treatments, better long-term prognoses, and reduced healthcare costs. At Sonde, voice is the new vital sign, and we have transformed voice-enabled devices that we use every day into a personal health tracker for mental and respiratory health conditions. Through a short snippet of speech, advanced audio signal processing, speech science, and machine learning, Sonde's platform analyzes subtle vocal changes due to changes in a person's physiology to be able to provide critical insights into a person's health as it evolves. By giving people a simple way to track and understand health changes early through voice, we are solving the engagement and activation challenge in healthcare, which will lead toward positive behavior change and ultimately disease prevention.
Hi, I'm Amy Lee, founder and CEO of Concha Labs. I have hearing loss, just like over 1.5 billion people worldwide who also have hearing loss. The market is similar to that of vision loss, but while nearly 95% of people with vision impairment wear lenses, only 20% of people with hearing loss wear hearing devices. Why? I can tell you from wearing hearing aids since kindergarten that hearing aids often have poor sound quality. Return rates can be over 20%, and over a third of people stop wearing them after a year. Because hearing aids are actually not personalized to us up front, they require manual fine-tuning through 6 to 7 appointments, which leads to expensive prices at $5,000 a pair, a huge financial burden, and still often sound awful. In comparison, through our product, our preliminary clinical results show that we can help people hear better than average audiologist fit hearing aids. And in some cases, we can help people hear as good as or better than normal hearing individuals. We are building the software hearing platform to empower us to personalize our individual needs and preferences across any hearing devices, whether it be hearing aids, smart earbuds, or other devices. Our patented technology, from years of innovative R&D, leverages proprietary data with AI built on top to ask evolving questions to mold your sound profile so that you can hear across the full range of speech and sounds clearly. We can personalize hearing in a higher dimension than traditional audiology, and learning from this data allows us to continually offer the best experience, as you can see from our user testimonials.
I could talk real low like this and see if you could still hear me. I can hear you. Kind of mumble.
This feels, again, clearer.
We are finally making hearing clearly a reality. We are Concha Labs.
I'm Jeremiah Robison, and I am the founder of CIONIC. The mission behind CIONIC is deeply personal to me. My daughter was diagnosed in 2010 with cerebral palsy, which is a condition that affects her gross motor skills and her ability to walk. And as a parent for 8 years living with her and her mobility difference, I was frustrated by the lack of solutions and the lack of technology to address her condition. And as a technologist, I had all this opportunity to bring to bear all of the amazing innovations that we've seen in autonomy and apply those to the human body to give her something better than crutches, canes, walkers, and wheelchairs. What our technology aims to do is actually not replace the skeletal system in the way that a prosthetic might, but we're actually replacing the neural signaling part of the brain responsible for sequencing gait and complex movements. As technologists, we are enablers, and we are enabling the world to be fully accessible. We have people who are using our sleeve out in the wild, and what we're hearing back from them is truly inspiring.
When I first put the neural sleeve on, I thought, it's hope.
This is going to change the face of rehab. You know, it's made such a difference in my life.
The other day I went for a walk wearing the neural sleeve, and it was helping me. And I realized afterwards, it's like, oh, the whole time I was walking, I was thinking about something else completely.
I've been a PT since 1976. The technology has changed so much, and the CIONIC sleeve has taken it to a different level than anything else I have encountered, either with patients or with myself.
When someone has a mobility difference, there's this feeling like I'm being taken care of, or that like people have to wait for me. What we really want is for them to be able to be living in the moment and being able to engage with their community and their loved ones in a way that really feels like they're independent and part of that experience.
My name is Dr. Raghav Murali-Ganesh, and I'm the CEO and co-founder of Osara Health. Over the years, we've made great strides in our mission to improve cancer care. While clinical care is essential, we believe that patients need more than just medical treatment to thrive. They need holistic, patient-centered care that addresses their physical, emotional, and practical needs, which is particularly crucial given that cancer care is a top healthcare cost globally. We know that patients who receive this type of care do better. 40% of those diagnosed with cancer are of working age, and a further 10% of our working population are taking on caregiving roles to their loved ones at their time of need. Of those diagnosed, 40% won't return to their previous lives and careers, with more than half wishing they had. Since launching our one-of-a-kind service back in 2016, we have supported thousands of people impacted by cancer in getting better health outcomes and returning to work. We've produced a number of clinical studies backing behavior change psychology as a means to improve clinical outcomes. 33% of participants report an improvement in pain. Not only that, but we've proven that participants return to work up to 17 weeks sooner than they might have otherwise. Welcome to Osara Health. We're creating a better experience for people impacted by cancer whilst reducing costs for individuals, employers, and insurers globally. We're confident that our approach to healthcare is both holistic and patient-centric. Join us in transforming the care in cancer.
Welcome to the world Soundwave Hearing is creating, where access to hearing aid solutions isn't limited by high costs and long waits. We're pushing boundaries with our Sancho OTC hearing aids and the groundbreaking AutoTune app. The Over-the-Counter Hearing Aid Act of 2017 paved the way when we seized the opportunity, delivering an affordable, personalized solution. Sancho OTC hearing aids are more than devices. They're a testament to advanced technology and ease of use. What sets the Sancho hearing aid apart is the AutoTune app, revolutionizing hearing aid fitting. With a 3-minute AI-powered hearing test, AutoTune tailors each hearing aid to the specific loss in each ear. No more one-size-fits-most. This is precision, personalized hearing from the comfort of home. We're about impact. Our approach not only reduces healthcare costs, but empowers individuals to control their hearing health. We're making hearing aid technology accessible for millions with untreated hearing loss. We've integrated AutoTune into a customized tablet for pharmacies. AutoTune Assistant providing a clinical service with a hearing test in just 3 minutes. Coupled with our Sancho OTC hearing aids and a collaboration with Amplify for a month-free oral rehab program, we offer a comprehensive solution for hearing health. That's why we deserve recognition as a rising star in the 2023 Digital Health Awards for the Consumer Wellness Division. Not just offering a product, we're transforming lives with our holistic solutions. We're pushing the boundaries of digital health, breaking down barriers, and enabling people to take control of their hearing health and social well-being, helping to avoid cognitive decline.
To Paloma Health, the online medical practice for hypothyroidism. Paloma Health is a full-service practice offering everything you need to thrive with hypothyroidism. Thyroid blood tests, doctors, nutritionists, thyroid supplements, support, and information that will change your life. The complete Paloma Health at-home thyroid test kit includes thyroid-stimulating hormone, free T3, free T4, and thyroid peroxidase antibodies. You can also add on reverse T3 and vitamin D tests. Thyroid testing has never been easier. Just buy your test kit at the Paloma Health website. After it arrives, register your kit online and take your blood sample. Then mail back your test with a prepaid label. After it's processed at the lab, your results are uploaded to your secure online dashboard within 5 business days. Getting a sample is easy and painless. Use the lancet from your kit to prick your finger, massage your hand, and add small drops of blood to the test card. How fast is that? You can consult with a trusted Paloma Health thyroid doctor by smartphone or computer. Paloma's doctors know their stuff and are able to write prescriptions and are open to all treatment options for hypothyroidism. Paloma Health's doctors are affordable and, depending on your state and provider, your costs are often covered by insurance. You can also do a video consult with Paloma Health's thyroid nutritionists. They'll help you understand your nutritional needs and develop a personalized thyroid diet plan just for you. Paloma's Daily Thyroid Care Supplement is backed by clinical research. It's iodine-free and provides 9 essential nutrients your body needs in just 2 daily capsules. The most affordable way to benefit from Paloma's groundbreaking hypothyroidism care is with a Paloma Complete Thyroid Care membership. For a low monthly cost, you'll have concierge access to tailored ongoing thyroid care. Members also get discounts on all Paloma Health products and services and other special member perks and benefits. And your Paloma membership quickly pays for itself with discounts on Paloma's at-home thyroid tests, low-cost online visits with Paloma's top thyroid doctors, and major savings on Paloma's Daily Thyroid Care Supplement. Supporting your healthy life with hypothyroidism is also part of the Paloma experience. Paloma offers a free mobile thyroid app with everything you need to manage your hypothyroidism. Get access to lab and symptom trackers, AIP diet guidance, recipe library, medication reminders, and so much information about all facets of Hashimoto's and hypothyroidism. And it's available for free on both iOS and Android. You can join us for Paloma-sponsored free live events, including virtual retreats and a monthly speaker series. View live presentations from top experts and ask your questions in real time. And don't worry if you miss one. Replays are always available. You'll also find dozens of free informational and educational videos organized by symptoms and topics on our YouTube channel. Whether you want to lose weight, understand your thyroid tests, or even need help falling asleep, you'll find a Paloma Health video to help. Visit our website at www.palomahealth.com to find everything you need to know about Paloma's innovative approach to hypothyroidism care. Paloma Health's blog has hundreds of free evidence-based articles on Hashimoto's, hypothyroidism, autoimmune disease, nutrition, medications, and related symptoms and conditions. Join us also on Facebook, Instagram, and TikTok at Paloma Health, and on Twitter, go to @HealthPaloma. You never have to feel alone with your hypothyroidism because Paloma Health has a free patient community and forum. You can give and receive support, share experiences, and learn new ways to feel great as you connect with other thyroid patients. Why should you choose Paloma Health for your hypothyroidism care? First, hypothyroidism patients are our top priority. We want to help get you feeling better faster. You'll also discover how easy your hypothyroidism care can be with Paloma Health. You'll get access to top doctors, testing, treatment, nutrition and lifestyle advice, support, and of course, information, and all from the comfort of your home. Finally, we're on a mission to make your thyroid care affordable and convenient. And because you'll be informed and empowered, you'll be an active partner in your thyroid care with a medical practice that always puts you first. And that can truly change your health and your life. Paloma Health invites you to learn more about our cutting-edge, personalized approach to modern hypothyroidism care. Becoming a Paloma Health patient could change your life.
Hello, I'm David Franklin, founder and CEO of knowRX Health. I would like to share some information with you about our consumer wellness mobile application, the AL app. This is very important to me because in 2018, I lost my father due to a medication side effect while in the ICU. From this pain, I ensued on a purpose and passion around helping consumers who are on a medication journey to empower themselves with digital technology through health education, medication adherence, and better communications with their care team. Now, with this data, we also are analyzing with machine learning technology to identify the probability of side effects using real-world data. Now, I believe my superpower is community service and keeping the customer or the patient centered to all that we do. This comes all the way back from my military training of serving others. And it continues today, not just with me, but within my organization. I believe that we are a great candidate to win this award because we are here supporting every day with a primary focus on impacting people's lives in a positive way that they can take ownership of their health through education and through participation and engagement for better health outcomes, starting with themselves and then helping others.
Lumos is an innovative sleep solution to help you get better sleep and wake up feeling more refreshed. It uses a proprietary algorithm and the light technology based on Stanford research to help the body restore its natural sleep cycle. The product consists of a soft sleep mask and a cell phone app. User will program the app and wear the mask while they go to sleep. During sleep, the mask emits very short, brief, low-intensity light pulses that penetrates through the user's eyelid. Such light pulses have been demonstrated to be effective in regulating human circadian rhythm. What makes Lumos unique is that it's non-invasive, non-pharmacological, and highly personalizable. The integrated hardware and software system also allow us to bring the benefit to the users without the user changing their behavior. It's also based on decades of research and has been proven to be effective in multiple IRB-approved human subject studies, including double-blind placebo-controlled studies. We all know the importance of sleep in wellness. Despite having so many products out there claiming to help sleep, the consumers are still looking for solutions. Solutions that are safe, effective, and easy to use. And that's what Lumos is. By solving sleep, such a big problem, Lumos is set out to change the lives of hundreds of millions of people and save billions in healthcare costs. Not only that Lumos is solving such a big problem, it's also deeply loved by its users. We have thousands of users out there, and 89% of our early users rated Lumos as effective. We have happy customers ranging from high performers, including world champion athletes, Olympic medalists, the US military, all the way to everyday people who just want to get a good sleep. Support Lumos so we can help bring a good night's sleep to everybody.